Your milk will most likely come in 3 to 5 days after delivery. You may not feel like you're producing anything until your milk comes in, but keep in mind that the colostrum your baby is getting is invaluable. You'll start to notice your baby swallowing more frequently when your milk starts coming in. Without stimulating your body every 2 to 3 hours by nursing or pumping, your body wouldn't know to produce milk. The more you nurse, the more milk your body is going to make. It's important that you feed your baby at least 8 to 12 times in 24 hours. Most breastfed babies will eat as much as 12 times in 24 hours because breast milk digests very quickly, and their tummies are small, so they need small, frequent feedings. A good feeding is defined as at least 10 to 15 minutes of rhythmic sucking on both sides, making the entire feeding 20 to 30 minutes. The milk your baby drinks during a feeding will change from beginning to end. Watery formilk comes first and provides your baby with hydration, nutrients, and antibodies. As your baby continues to nurse, the milk will become more creamy as a sign that the baby is accessing the hind milk. It's plentiful in healthy fats, and a good balance of foremilk and hind milk will allow your baby to thrive. Babies are good at knowing when they're hungry and when they're full. Your baby will tell you when he's done nursing, so just watch for the signs. When he's finished, he'll let the nipples slide out of his mouth and he'll just appear to be very satisfied and happy. Because nursing is comforting to your baby, he or she will often fall asleep at the breast, but this doesn't necessarily mean that the feeding should be done. When this happens and you feel like your baby isn't ready to be done, try changing sides, massaging your baby, or changing his diaper. Burping can help to keep your baby engaged during a feeding too, and it's important to do it. It helps to minimize gas and discomfort. When babies eat, they naturally swallow air, so you'll want to burp your baby midway through each feeding. If you're nursing, stop and burp before you switch to the other side. And if you're giving your baby a bottle, feed him or her a ½ ounce at a time and burp in between. Expect a few wet burps and a little spit up. That's normal. Sometimes it just happens when a baby is overfilled. But watch for vomiting, which is when a large amount comes out of the baby very forcefully. If this happens, you should contact your pediatrician. In the Guide to Breastfeeding, there is a log where you can write down when and how long your baby eats. You should also track how many wet and dirty diapers your baby is having. It's important to write down this information so that you and your nurses can see what your baby is doing. Continue to keep this log for at least 2 weeks because your pediatrician will ask you about the frequency of feedings and wet and dirty diapers at their first office visit.